start on your right shoulder. We're looking in from the back to the front. We examined your shoulder like we talked about before we started. It was very, very unstable to the front. And so now we're going to make a quick assessment of the initial injuries. This is your biceps tendon. Remember we talked about that area of the shoulder between 11 o'clock and 1 o'clock? And here's the tear here. So that's the slap lesion, right? See how this tissue is very, very loose. That biceps anchor really isn't attached to anything there. So we're going to try and repair that for you today. This is the rotator cuff up here, and the cuff looks fine. What's not going to be fine is here. As we come towards the back of the shoulder, you can see pretty significant injury to the ball here, where it's almost sheared off a large part of the cartilage there. So we're going to have to decide how to address that. We may do what we call a Remplissage type procedure, but I haven't decided that quite yet. We're going to look from a different angle. Now we're going to look down the front also. And here's the injury down the front, where the bumper's been knocked off the front down here. So first thing we're going to do is decide what to do in the back. So we'll go off on the video for just a minute here. Okay, so here we're looking from the front at this injury to the posterior aspect of the humeral head, and we're using this kind of rounded probe just to make sure that this isn't loose. And as we push on it, this injury to the ball is not loose, so that's good, particularly right here. That obviously is loose down there. We can deal with that, but this large piece is not loose. As we look at the labrum down below, a little bit of tearing here. And one of the things that we sometimes do is we place a suture anchor into the bone back here and help tighten the capsule and the ligaments that way. So we'll go off on the video for just a minute. Pause first. Okay, so now we've got a rasp in here. We use this to roughen up the capsule back here. And then also we can see the area where we're going to be placing our suture anchor up in this area here. We'll keep working here and show you some more in just a minute. Okay, so we spent a little time preparing the bone here. Didn't have to do much. We just scraped off some of it's basically scar tissue. The body had been trying to heal this, what we call a Hill-Sachs injury. And we're going to place a suture anchor into the bone, basically right about here. Now, putting in the preload. Hold on one second here, we'll show you some more in just a minute. Okay, so here you can see our anchor going into the bone. Back on it, and you can see when I pull on these sutures, it brings the whole ball backwards. See there? And so that looks pretty good. No, bring that back on a little. So there we can get a sense of the fact that you haven't lost a lot of glenoid bone. So we're going to go ahead now and work with these sutures and pass some stitches. Gotta get that to give it that address. Okay, so we'll take that one out the front. Now to pass stitches for this type of procedure, we just use a spinal needle. But first I want to check to make sure I have a good angle. That's going to be pretty good there, scalpel. Okay, here you can see the first pass. And through that little needle, we're going to pass a black wire called a super shuttle. There you can see it coming into position here. Where we retrieve that just depends on the angle. Usually we can get it pretty easily from the back here, like that. Now we're going to pass this out to the front. To the front. This will be the other black and white striped suture. Okay, so there we've got the second one ready to go. Pause, please. Okay, so there's our first mattress stitch there. Now we're going to make another mattress stitch. First we got to pick our spot here. Basically we want it right above the cannula. Something like that would be a pretty good spot. So we'll go ahead and make a little nick in the skin there. Okay, so we passed one of the blue and white stripe sutures. And now we're going to get the other right here. Give me a picture. Or a picture. Pull the cannula back and push in the crochet hook. Okay. And now we're ready to pass that again. I don't need to be much more superior, so I think this stitch is going to go actually right about here. Not a bad spot, right about there. And so load that. I'm going to show you some a little bit. Well, actually, let it run for a minute. We'll just pull slowly here so you can see how that works. So there it is, bringing that stitch out. Okay. And this extra suture, you don't really need at this point. So we'll get rid of that. That's what we're left with. Now we'll tie all those at the end, but you can see how that's going to bring that down there. Now we're going to get to work in the front of the shoulder where you can see we've got some damage here to reconstruct. Pause, please. What we're looking at here is this damage down the front of the shoulder. It's real typical for somebody who dislocates. reconstruct it properly. Shaver, clean things up a little bit, and show you some more in a minute. Okay, so our first anchor is in. Hold that just like that. We're going to tug on it, make sure it's seated. Feels very solid. We're actually going to take out one of the sutures out the back here, just like that. And then in the front, we're going to take a suture hook. This is what we call a turn to the right suture hook. We're going to have it finished right here, so we're going to rotate back. See, it's just coming through right over there. Feed that through. I'll grab that with a grasper. And now we're in business, so we'll show you some more in just a minute. Okay, so here you can see that first loop going around. I like the way that looks. We're going to go ahead and tie that here in just a minute. Pause, please. All right, it's actually hard to see, which is a good sign. There it is down there. And now we're going to pass this second one, so we got to get the suture up first. And then we'll take a switching stick just to hold this in position. It's a good tip. Sometimes it's hard to keep this right where we want it, just because it helps. You can see how it helps separate the joint a little bit. So that's perfect. Just hold the cable. Okay. And so now we'll take our suture hook. And we're going to start here. The ligament that we're trying to take a bite of there is called the inferior glenohumeral ligament, and in particular it's the anterior band of it that we're working on here. So we'll just work through. That looks like a pretty good shot right there. We'll feed. Feed the shuttle relay. Grab it just like we did before, possibly. Okay, what we're showing you there, aim down. Let me take it. What we're showing you there is the second one tied, and now we've got a third anchor in right there. This is all still in the front of the shoulder. So just like before, we're going to place another hook in and pass another stitch around this bumper in the front. Here's the hook. There's the wire. So right about here. Care to make sure we get around the entire labrum for you. Pause, please. Okay, so we we've got all 3 sutures tied in the front. I'm going to put our shaver and make sure there's nothing else to clean out. Now we've still got to look at that biceps anchor, remember, that's the slap lesion part of things. Okay, so we'll go off on the video, show you some more in just a minute. Okay, we're just making sure that we have as good a vascular supply to this area as possible by using these little picks to bring some more blood supply to this area. It's pretty soft at the base and it's pretty deep, and we sure don't want to destabilize what's still there. I think we'll have plenty of blood supply, plenty of bleeding in just a minute. So we're going to go ahead and put the camera in the back and switch from the back to the front. We've got a different kind of implant here. This one is large enough to have 3 sutures, or actually really 4 suture tails that we can use. We're taking out 3 of them now. And the 4th one is the first one that we use to pass underneath the labrum. So there's 3 of them outside the cannula, and then we'll take this 4th one inside. And now we'll take a hook. We're going to try and get behind the biceps somewhere here. Save us a little bit of time, we'll take out one of these black and white stripe sutures like that, and then we'll place that inside the cannula because we're going to pass that one next. But before we pass the black and white one, we're going to go ahead and tie this blue and white one right here. Pause, please. Let me see the shaver. So we've got this biceps anchored down. Make it too tight. Now we're just debriding the labrum a little bit here. So the next step, which would be the final step, that's the injury to the ball there, is going to be to tie those sutures right there. Okay? Pause. Okay, we're all done. We've tied those sutures to connect the capsule to the back of the ball. See how it's right above there? That looks good. So we're going to finish up now and get you back to the recovery room shortly. Good luck to you now. Bye-bye.